So Jason and CA, this is Lisa from NCPA. I want to make sure that we're doing a good job of talking about how having multiple pharmacists, community pharmacy representatives participate in the grant helps us cover the huge number of issues that's going on at NCPDP. So I know that each of you are tracking a particular issue in different work groups that I want you to highlight now. So Jason, if you want to start, tell us about the issue that you're following in Work Group 1, telecommunication.
The issue I'm following is the point of sale denial to be returned when a patient specific denial for a drug needs to be individualized for that rejection that prints out at the pharmacy. We're following issues and having a problem being able to get that data in real time and trying to figure out if the best way is to return it in an attachment or automatically fill out a form. We're looking for different people from different parts of the industry to really participate in this panel, and we've had a little bit of struggle getting everybody in on this subject. Hopefully this next 3 months we're able to get more people from different areas of the industry to help solve this problem.
And of course, this is a really important issue because we see where 4 states have very certain conditions where pharmacies need to provide this information to patients.
Right.
in different, 4 different ways because it's a state deal, but we've also seen that there may be interest on the federal level of providing this in maybe a more standardized way. So the timing for this task group's work is perfect.
Yes, very much so.
Good. CA, do you want to talk about the issue that you're following in Work Group 11, e-prescribing and related transactions?
In Work Group 11, in e-prescribing, I noticed beginning of the year we were not getting the MBI return in E1 transaction. And I had the opportunity to ask Shelley, the representative, CMS representative over Part D programs, and her response was that she actually addressed that response in her report to the entire group this morning. The response was that in the MBI, it was a security issue. They thought it was apparently more risky to return that Medicare beneficiary identifier in the E1, and it's apparently a little more restricted access, although it is available on their website. That's one issue. The other issue that interests me is in MC. It's the issue of digital therapeutics. It's at least new to me, and it's a new concept, and the industry that represents companies involved in digital therapeutics are advocating that when there's insurance coverage that they be billed through the NCPDP prescription benefit standard. So, there may be opportunities for community pharmacies to take advantage of this new mode of treating patients, a new service perhaps that we can provide, and if so, it takes so many forms, whether it's FDA approved, non-FDA approved, requires prescription, but in many cases the NCPDP standards will be involved, and pharmacies that desire to know more about it will need to be prepared to take advantage of the opportunities they have.
CA, you brought up an interesting issue when we were having lunch yesterday, trying to figure out what's the difference between a digital therapeutic and a medical device and how that nuance plays out in pharmacy. Where do you think we go from here? Because I don't know that we came to a good understanding how we would explain that to somebody, even though we kind of understand it in our head how it's different.
Well, I think at this point it may be the Wild West. So I don't know, and that's why it's important to keep up with it, because sometimes this is involves being utilized with prescribed medication, or certainly would involve patient counseling, patient intervention, patient education. The question is, are digital therapeutics merely software that someone can download on an app, receive a a product code, an authorization code, and then just a bill through an NCPDP standard, not involve an actual retail brick and mortar community pharmacy at all? Or is it something that community pharmacy can add to its suite of services that they provide to their existing clients?
Do you want to add anything?
I think this is a real important topic. It's really going to affect retail pharmacy, and we need to stay on top of it.
Thanks, you guys. This is Nicole with NCPDP, and I think that it's interesting that you both are tracking work within NCPDP on two opposite spectrums. So Jason, you talked about the telecommunications standard, which is more on the billing side, and CA, you talked about the script standard, which is on the e-prescribing side. So can you tell me a little bit about how, as grantees, you are collaborating to make sure that you're covering all ends of the spectrum of the work that's being done here at NCPDP, and also in your perspective, why it's important that we have multiple grantees participating in this program?
There's so many different areas of NCPDP that there's just so many areas. There's so much that goes on at these meetings. It's nearly impossible for one person to be able to do everything. It takes really more than two of us to even scratch the surface of what goes on here at NCPDP.
Do you have anything to add, CA?
No, I'd like to, emphasize what he just said. It's community pharmacy is so complex. Even another issue that came up, or not an issue, but an observation, was the different standards that community pharmacy and community pharmacies are affected by, whether they realize it or not. For instance, on the medical billing side or the DME side, you have the X12 standard. Of course, you have NCPDP standards. With the e-care plan, there's the HL7 standards. Another group that I've been following is the harmonization, because in a community pharmacy, you typically do so many different things, and it's hard to find expert advice and depth in any one area, but you need it in all the areas. So there is so much to cover and so much to keep up with. We need a lot of eyes on the issues.
Thank you, guys.